Hi everyone, welcome to my channel. My name is Dr. Wan, and today I am to talk about diabetes and how it is related to the menstrual cycle. Once more, please subscribe to my YouTube channel, like it, and share it with your friends and loved ones. So here we go. How does diabetes affect the menstrual cycle? Diabetes may cause unusual changes to a person's menstrual cycle. Likewise, the hormone changes that happen throughout the menstrual cycle can affect a person's diabetes. Having said that, how can diabetes affect the menstrual cycle again? So essentially, it has a lot to do with the hormones in this case, and also the age range. Those are the two factors that are very important, and those are things that I will pay more attention in this clip. People with diabetes may have an increased risk of experiencing irregular or unpredictable menstrual cycle. Type 1 diabetes should not affect the regularity of menstrual cycle or the heaviness of a person's period. That said, menstrual irregularities can sometimes occur with this condition. Menstruation can begin at any time throughout puberty, but the average age is 12 years. Type 1 diabetes should not affect the age at which a person has their first period. However, there have been some reports of a late first period in people with type 1 diabetes. That said, as long as the person is not underweight and they are able to manage their type 1 diabetes well, they should not experience any delay in starting menstruation. People with type 2 diabetes are at increased risk of anovulation. This occurs when an ovary does not release an egg into the fallopian tube. When this happens, a person will not have their period. Although the risk of anovulation is higher in people with diabetes, not everyone with diabetes will experience it. Developing diabetes. There may be links between irregular menstrual cycle and the risk of developing type 2 diabetes. A large case study from 2020, which involved 75,546 females, investigated a possible link between menstrual cycle dysfunction and the development of type 2 diabetes. The study found that those who had experienced long or irregular menstrual cycles in their teenage and adult years were more likely to develop type 2 diabetes than those who had experienced regular menstrual cycle. This point is very important. Please take note. According to the research, hormonal imbalances may play a critical role in the link between irregular menstrual cycles and the development of type 2 diabetes. They add that long and irregular menstrual cycles are strong indicators of increased insulin level or hyperinsulinemia, that is high insulin in the blood. This can trigger a cascade of events that eventually exacerbate insulin resistance, in which the body is unusual to use insulin to control blood glucose level effectively. In this study, some other risk factors for type 2 diabetes include having overweight or obesity, being physically inactive, consuming a low quality diet. Blood glucose, insulin, and the menstrual cycle. Explain. During the menstrual cycle, changes in hormones can affect insulin and blood glucose levels. After ovulation, a person enters the second half of their menstrual cycle called the luteal phase of the menstrual cycle. This phase is characterized by an increase in the hormone progesterone. Increased level of progesterone can cause temporary insulin resistance, which healthcare professionals call luteal phase insulin resistance. A 2013 study involving 6 females with type 1 diabetes found that blood glucose levels were higher during the luteal phase of the menstrual cycle. Additionally, some people with type 1 diabetes may experience lower blood glucose levels at the start of their periods. They may need to alter the insulin intake accordingly. Blood glucose level usually return to normal after a period has ended. Polycystic ovarian syndrome and diabetes. This is another interesting topic which we call it PCOS. So, polycystic ovarian syndrome, also known as PCOS, is a condition characterized by an increase of reproductive hormones. People with PCOS have higher levels of hormones called androgen, which can prevent ovulation. Some symptoms of PCOS include irregular period, weight gain or difficulty losing weight, acne, excess hair on the face or body, thinning hair on the scalp, darkening of the skin around the neck, breast, and groin, skin tags in the armpit and neck area. According to the Center for Disease Control, people with PCOS often have insulin resistance, which increases the risk of type 2 diabetes. This risk further increases if the person also has overweight or obesity. The Center for Disease Control also states that more than half of people with PCOS develop type 2 diabetes by the time they reach 40 years of age. People with PCOS may be able to reduce their risk by maintaining a moderate weight through diet and regular exercise. Now, having said this, the next step will be to see a doctor to see how to address the issue. So, when do you do that? Regular and predictable menstrual cycles are important indicators of overall health. As such, a person should contact a doctor if they experience irregular menstrual cycle or unusual changes to their menstrual cycle. A person should also contact a doctor if they experience any of the following: no period for longer than 3 months, heavy period with large clot of blood lasting 5 to 7 days, bleeding between periods. If a person has diabetes and is finding it difficult to control their blood glucose levels during certain stages of their menstrual cycle, they can contact a doctor to discuss the next steps. A person may find it helpful to track their blood glucose levels throughout the menstrual cycle so that they can detect any pattern in their overall health. Now, with regards to solution to this problem, treatment can be done. Say how to manage your diabetes. That's also a very important aspect. It is important that people with diabetes take steps to monitor and control their blood glucose levels throughout the menstrual cycle. If a person has type 2 diabetes and is not taking insulin, getting regular exercise can help reduce their blood glucose level. People may need to maintain regular exercise before and during menstruation or whenever their body glucose level begins to peak. People may find that their appetite increases before their period. In order to prevent blood glucose level from rising, they should try to avoid refined carbohydrate. Some examples of refined carbohydrate include white bread, pastries, white rice, pasta, breakfast cereal, soda, food containing additional sugars. If a person is taking insulin, they may need to alter their dosage throughout their menstrual cycle as well as manage their intake of carbs. So that's what I would say with regards to your diabetes and your menstrual period. It's very important, so please take this serious. So to summarize things again, I will go through a few points here and then call it off. People with type 1 or type 2 diabetes may have an increased risk of experiencing irregular or unpredictable menstrual cycle. It is important to note that hormonal changes that occur during menstrual cycle can also affect a person's diabetes. Hormonal fluctuation can trigger changes in blood glucose levels and insulin levels. So, people with diabetes need to take steps to manage these changes. A person should contact a doctor if they have diabetes and are experiencing irregular or unusual menstrual cycle. They should also contact a doctor if they are finding it difficult to manage their blood glucose level throughout the cycle. So far, so good, and thanks for listening. My name is Dr. Wan, and please subscribe to my YouTube channel, like it, and share it with your loved ones. Thank you. Bye-bye.